just wanted to say, it just reminded me of, sort of friends from my, I would say, teenage years. Who were slightly overweight, and they would start counting calories. And I remember many of them would look at a bar of chocolate and look at the package and, oh, okay, so only 100 or 200 calories in it. So they literally would count like up to 500-600 calories. I don't understand calories. I've never counted calories, but 600 calories per day. But all they would eat is 2 bars of chocolate to add up to the 600 calories. Of course, they're setting themselves up to failure because they probably ended up nutritionally deficient. You're not getting the nutrition your body deserves from those 2 bars of chocolate per day. And they would be constantly hungry. So they would give up. Oh, I'm not dieting now this week, but maybe I'll start again next Monday. So you are set up, they were doomed to fail.
Yeah, I think the problem is nobody taught people how to eat. Nobody's taught people how to eat. Like, how do you eat to be full? How do you eat to understand your hunger? How can you decrease your hunger in the short term? How can you decrease your hunger in the long term? How do different diets work, right? And nobody's done that. All they do is they take somebody who's most likely to blame themselves, right? Most likely to blame themselves, right? Somebody who struggled with obesity lifelong, right? And weight loss issues lifelong, right? Even diabetes patients, right? When you walk into the office and the doctor says your A1C is 8.5, 90, you have to do better, right? Like, how does that feel, right? You're more likely to blame yourself, right? So if you're blaming yourself and they set you up to fail, when you do fail, who are you blaming? Yourself, right? And nobody's thinking, wait a second, like, maybe I have it all wrong. Maybe I don't understand the power and the nature of what it is I'm trying to accomplish. And most people don't. They come into my office. We've helped over 1,000 patients lose 40,000 pounds. Okay, we've helped over 1,000 patients lose 40,000 pounds. We've published countless things into the medical literature, including triglycerides going from 1,000 to 150, A1Cs of 12 going to under 6. I mean, we've put it all there. Now, binge eating symptoms going from through the roof to non-existent. So the issue here is our doctors have not taken enough responsibility. Our nutritionists have not taken enough responsibility, right? If you give a drug to somebody and they don't tolerate it, well, now you're on the hook to help that person find something else, right? You can't just abandon them and let them blame themselves. So this is a problem. I think most doctors, dietitians, personal trainers, they're not equipped to deal with this.
No.
This is a new phenomenon. So even when we say home cooked, you're like, I'm not sure it's really home cooked. I don't know if that makes sense, but like, to your point, all those things you ate, even the traditional staples, and even, let's say, the other things, chocolate, ice cream, pizza, bread, right? That endocrinologist, did she ever say, hey, you can use this almond flour, right? And you can put it with a little bit of butter. You can have bread. It's going to taste awesome. Did she ever say, you interviewed Rosette? I know Rosette mentioned she talked to you. This has been her passion. Do you know how many people, lifelong type 1 diabetic patients, that their life has been changed, that they can enjoy a bread without any blood sugar fluctuations, that they can enjoy a piece of cake? And most of the patients that have type 1 diabetes, they don't want much. They just want to take, hey, all you need is a little bit of monk fruit and almond flour, right? None of this is health food. None of this is weight loss food, right? But it's a way to eat low glycemic food, right? Did that endocrinologist tell you you could take cacao, put a little bit of sweetener in it, and now you can enjoy chocolate? Did they ever say that to you? Did they ever say to you, you can get a zucchini, you get a spiralizer, it's going to taste like the best pasta you've ever had? Did she ever tell you that?
No.
Right? And so you felt bad, But in reality, they didn't give you the tools. So this comes back to responsibility, right? While it's true, the endocrinologist doesn't force feed you carbohydrates. What did they do? They shamed you, they blamed you, and they gave you no tools. So this is my passion. It's like, I'm here to disrupt medicine. I'm here to take all of these people and show them how inadequate they are and give people a different way. Because this is the standard of care. Shame, blame, and no help. Hey, in front of me is somebody who's having trouble managing their blood sugar. Maybe I should show them how to eat food in a way that doesn't make it worse, right? That is, it's her fault. She needs to do better and learn the thing more. It's, how can I help, right? So I'm very passionate that doctors need to take responsibility. Sorry, and they need to critically think, because they don't.
I would say when I first started low carb, it was, I found out about it and I wanted to try it, and I had absolutely no support. I've said this over and over again in my channel. As a type 1 diabetic, I would have appreciated. In fact, I needed the support, but I did very well without that support, without that acknowledgement and encouragement from my physicians. But I remember in the very beginnings, my diabetes consultant, or endocrinologist, as you call them in the United States. So my diabetes consultant told me, oh, there is not enough data, which now I know is wrong, about this low carbohydrate lifestyle. Besides, she said, and this is word for word, I remember it. She said, you're still young, so if you are considering having a baby, cutting out carbohydrates is not going to help you. This is exactly what she said. You need carbohydrates to remain fertile if you are going to have another baby, because you're still young, she said.
That's bullshit.
Now, I know that is
she lied. Sorry, she lied.
Complete nonsense. I know that.
Yeah.
So, but now the tunes change. Now I have another diabetes consultant who at least supports. But I feel I personally understand my day-to-day management of my blood sugars by eating high protein diet, which is what I'm doing right now, but better than he does. He doesn't understand it, but at least he is not dismissive of it. And he tells me, whatever you're doing is working for you, so keep doing what you're doing. And sometimes that's, as a patient, that's all you need to hear. You need to be told, you're doing well, keep it up. I think it's important. I think it's extremely important, even if they don't have the right knowledge to give you the exact, sort of pieces of information you need. At least telling you, not dismissing you, is quite a big deal as a patient.
I'm going to tell you that I think we can do better. This is why we do it remotely. We monitor people remotely. We encourage them remotely. We offer support remotely. You're at home using your CGM. We say, great job, Nayiri. You're at home using your CGM and your glycemic variability, your coefficient of variation increases. Hey, can we help you, Nayiri? Like, what's going on? Right? Can we do something to help you? Or we see the weight passes a certain threshold and we reach it, we text you. Is there a way we can help you out, Nayiri? We know that 99% of weight gain happens under extreme stress. So we try to be a beacon of stress relief in a community for people. I think the current model of medicine is a disaster. Just flat out is a disaster. We have lemmings, we have people uninterested, not curious, and not responsible. They've said that the population is not responsible. So 80 to 90% of people want to do good. Will do what they're told, right? So who's responsible here, right? That's my philosophy is the doctors need to, and the dietitians and the personal trainers and the weight loss companies, right? They're responsible. So I'm a, look, I'm sure your diabetes doctor is wonderful. I'm sure they're wonderful, but our profession needs to do better. I firmly believe that, and I'm working towards that. We're hiring doctors, right? We're expanding. We made the Society of Metabolic Health Practitioners so that doctors could get educated. They could get a program to give them basic education in lifestyle modifications with regards to metabolic health. We've published it into the literature. In fact, another thing, Nayiri, I published it into the literature. Hey, we can predict who will get a high LDL with a low carb diet. We can help you predict it. And if you get a high LDL with a low carb diet, here is a potential remedy that may work, right? That has nothing to do with what you thought it was, which was saturated fat. We published this into the literature.